Hey y'all, this is Dr. Tasha. Okay, so I'm coming today from a space of chastisement, if I'm gonna be honest. And this is for my black girlies. I hate to say it, but I gotta come at y'all today. And not in a negative way, in a loving way. And let's stop this so we can fix this kind of way. The last video I did was about pre-diabetes and blah, blah, blah. If you haven't had a chance to check it out, go check it out. It was a really good video. And a lot of people snapped back and was like, listen, I didn't know it was a thing. My doctor really didn't make a big deal out of it. And I want to fix this thing. And I'm so grateful and I'm so happy about that. And that's why I do these videos, right? But today I really want to speak from another perspective. I want to speak from the other patient. I want to speak from the patient's perspective that does not want to know. And we have to stop that. And I say denial is a real thing in our community, right? And I think that with justification, meaning I think that we've been, how can I say this? So confused. We've been so led astray, hoodwinked, bamboozled. No, I'm playing, but I'm serious. It's been so much where now it's just like, you know what? Just don't even tell me nothing because I don't want to deal with it. I got too much on my plate. I got too much going on between these kids, this job, this weight, these finances. Life is lifing. I don't want to hear nothing else. Like, just don't tell me nothing else. If I can't feel it, if it ain't killing me, girl, we're going to have to leave that on next month's list of things to think about, worry about, and deal with. And I don't want us to be in that space. And I have to be honest and say I'm guilty of it in some respects myself. I just can't deal. I don't want to deal, but I make myself deal. And that's a space of, it doesn't matter what it is, especially medical problems, right? And we are such in a space of, like, when I will see you guys in my office and I'll see somebody with a blood pressure of like 160, whatever, over 100. And I'm like, well, are you hypertensive? My blood pressure fluctuated a little bit. And I probably gained a pound or two, but I need to start walking again and then I'm gonna be fine. Now, while that may be the case, hear me out, okay? Because here's what I need to tell you guys. And when it comes to blood pressure, for every day, your blood pressure is elevated. You can't feel it. You don't know. You are ignoring it. You're killing your kidneys. Why do you think it's a dialysis clinic everywhere in the hood? That is what you're doing. You're not doing yourself any favors. You're not, I'm going to get it under control. Again, it's not your fault. Hypertension is genetic. It is genetic. You have it because one of your parents had it. So you can control how severe it is. You can control how early on you get it, but likelihood you're going to get it. So at the end of the day, rather than spending years or spending a whole bunch of time denying a diagnosis that you may have, my suggestion is usually buy a blood pressure cuff. Read the instructions, make sure you know what you're doing, make sure it's the right size, because the size that say large, that's for skinty people, okay? Go on and get that extra large cuff. Make sure you got the right size, and check your own blood pressure. And I give them parameters, and I'm like, check it yourself. See, you can figure it out yourself, but if you are hypertensive, and that means if you have 2 abnormal readings within 12 hours, girl, it's time to go deal with that. Yes, we want you to lose weight. Yes, we want you to change your diet. Yes, we want you to walk. Yes, we want you to drink water, but we need you treating the actual disease or disorder that you have, okay? So it's stuff like that, and we have to get away from that. It's like, I can sit with somebody, do you have that? Oh yeah, but it's like all these excuses and all these reasons. And like I said, it's anxiety ridden. I get it. You don't want somebody giving you a bunch of medications you don't need. You don't want a diagnosis that now you have to deal with, and you have to come to grips with mentally that this is what's happening with you and inside your body. And now you got to deal with this, and now you got to think about this. I get it. But that is the beauty of prevention. And this is what I tell people who come into my office, baby, do not be scared. There are so few things that you could actually have wrong with you that I can't fix in this stage. You would have had symptoms on symptoms on symptoms on symptoms if it was real bad. And I'm like, ooh, girl, we got to send you somewhere because we don't do that up in her. It would be, you would have symptoms on symptoms. So if you really don't feel anything, I'm kind of telling you, you might see a little something, but you're like, is that what that is? Likely I can fix it. So don't be afraid. It's like the fear is what cripples us. And the fear is what, and this is what I always share this analogy with my patients. And, you know, please don't get in the comments and be like, well, you know, these people get sick too. These people, we're comparing apples and oranges. And at the end of the day, what makes that the standard for acceptability? Period. So what I'm saying is that I'm talking about these people right now. Okay, great. So what I tell people is this, and when we talk about like mammogram, oh, I had my mammogram 3 years ago, I'm good. No, you're not. You need an annual mammogram. I don't know what these new recommendations are, and trust me, these recommendations are designed so that they can save money, not that they can save your life. Let me be very clear. Oh, we get so many false negatives. I'd rather have a gazillion false negatives than a positive that we miss. That's just how I roll. That's how I ride. Okay. So at the end of the day, I tell people, here's the difference. Sylvia Rubinstein. Y'all know what that means. And if it's a Sylvia Rubinstein out there, girl, I don't know you. This is a random name. Sylvia Rubinstein will go to the doctor every 15 minutes. I got something in her breast. I got something. And they're going to check it 100 million times. And one time it's going to be something. But she checked. Sylvia Robinson, and I don't know you either, sis. These are random names, but y'all know what I'm talking about. We'll ignore it. She got stuff to do. She got to go to work. She got to get these kids somewhere. She got to do this. She got to do that. She ain't got time to be worrying about it. She don't want to pay for no medication. She don't want to pay for the mammogram. She got a copay. She got all these random reasons why not to evaluate and investigate something, right? And then she gets found, and now she's a stage 3 versus the patient who is just all over the place, wanting to be checked all the time for everything, is a stage 1. And the point that I'm making is stop ignoring stuff. Stop ignoring stuff. It is okay. It's okay to be scared. That's what finding comfortable doctors is all about. That's what taking a support person with you is all about. You don't have to be on an island alone, but give it a chance. Give yourself a chance. Give your provider a chance to find it and fix it. I always say that I'm going to walk you through. Oh, I'm going to walk you through. But at the end of the day, just give that chance. You know, the women who come in, child, I keep peeing on myself when I cough, when I sneeze, when I laugh. Stress incontinence, that's what it is. You ain't do nothing wrong. You're a little fluffy around the middle. Your pelvic muscles are a little weak. You had children. You had some childrens, okay? And that's what happens. You got a little fluffy, okay? You ain't nobody doing them Kegels, okay? We busy. You got to do 4,000 of them to make a difference. We busy. Okay, but it is some stuff that we can do. And if I don't want surgery, you may not have to get surgery. You know, they do slings in the office. You might not want a sling. They do something called PRP. And PRP, they will inject your own plasma around that area so you don't leak. It's so much stuff to do. But resolving to the foot, well, I'm gonna just pee on myself, and then you got fishy smelling panties, or either you just got them pissy depends on. And shout out to the women who got to do that. It's all good. We're not in judgment over here. We are in a space of accountability, but we're not in judgment. But what I'm saying is that nobody even wants to go evaluate, because in your mind, when somebody who you talked to had it 20 years ago, the technology was different, the procedures were different, a medicine was different. So don't feel like what they're telling you, because it's what they went through, is the only thing. See about yourself, sis. I don't care what that is. That is hair. Oh, my edge is thinning. See about that. See about that. The first thing I always do when I feel like my edge is thinning, I be like, oh, because a lot of times it's fungus, right? So, ooh, what can I put up here? And interestingly, I ain't gonna tell y'all what to put up there, because you're gonna be like, ooh, Dr. Tasha told me to put this up there. My edges came out. I ain't gonna tell y'all. But it could be fungus, like, and that's a kind of like an easy fix. Like, what am I gonna do about that? Let me see a dermatologist. Let me see a trichologist. A trichologist is somebody who specializes in hair growth or whatever. It's somebody in every city, child, you know, especially here in Atlanta, child. Everybody think they specialize in something. But anyway, so let me see a trichologist. Let me get my skin together. Be proactive, ladies. Like, we could literally add so many years onto our lives, be with our families, look well, live well, feel well. Stop being scared. please, I implore you. And if you're scared, if your doctor makes you anxious, if it's like, honey, every time I come up in here, my heart be beating, because a lot of times that happens in my practice. People be like, every time I come up in here, my heart be beating fast. Now, that's for two reasons. Either one, you're new, or two, you know I'm gonna curse you out because you ain't do something you were supposed to do. Don't even let your heart be fast. Just take the beat down and keep it pushing, and we're gonna do better next month. Because I'm gonna check you, but I'm gonna love up on you too. And I'm gonna help you figure out how to do it better. And I'm gonna figure out by talking to you what was so hard, like what made you not be able to succeed in the way that you wanted to. And we're gonna hash that out. We're gonna figure it out. I'm gonna help you come up with the plan. And then we're gonna do better next month. So yeah, I'm gonna check you if you're just being lazy, but I'm still going to help you and love up on you, because that's what it's all about. So if you're in a place where you just can't get comfortable with somebody, please go somewhere else, because the number of people, not patients. Child, somebody cut on that other line, honey. But the number of people who actually, said to me, I didn't know this was an issue. I didn't know this was an issue. I didn't know this was an issue. That pains my heart, because these are people who are going to the doctor. They're trusting the word of their doctors. They're trusting the skill set of their doctors. And what are they getting back? They're getting half-ass care, to be perfectly honest. And so that really burns me. So I really want us, can we make this the year and we ain't got to wait till January. Like, we can start right now and make it a full 12 months. Because that's a year. We don't have to wait until January. Can we make this a year of being proactive and making people stand on business? Y'all make these hairstylists stand on business. Y'all would not play with them if y'all leave out was not perfectly flat like a bust down. Y'all would not play with these people. Y'all be like this at your nail tech, like it's a little piece of hanging. But you don't do that to your healthcare providers. I don't understand that. Make it a year of making these people stand on business. And at the end of the day, like I said, you have so many doctors in the world. Like, don't stay with somebody who you don't feel like you're getting answers from, or you're being comfortable with, or, you can say, listen, this is what it is. This is and go with your questions. Go with all of that. Guys, it's so important. And I want us to be okay. Like, I just want us to be okay. And I can't see everybody. I can't fix everybody. My goal is to get as much information out with the videos as possible. That's why it's so important that you like them and share them, but especially share them, because, somebody else may not have the opportunity to see a me, or whatever the case may be. And I just wanted, us to be okay. So be proactive, ask the questions. Don't be afraid, ladies. Like, very seldom is it going to be something that cannot be fixed. And another thing, I'm about to start going in on hardcore. Y'all know I don't play about it. Y'all know I don't play about it, but I try not to. It seems like y'all get so scared. Understandably, but y'all get so scared when we talk about HIV and Black women, because I don't know who didn't tell y'all, but y'all know it's an epidemic, right? Like, we're still in crisis. Like, other demographics are not. LGBTQ is not. White males are not. Black males are not really even. But as far as Black women, we're still in an epidemic. We're in crisis. Again, nobody's coming to save us, but we don't want to talk about it. It ain't us. I don't want to hear about that. I don't even want to think about it. And we got to get away from that too, because yeah. So anyway, guys, I hope that this video helps somebody. And the purpose really is being in a space of not being afraid to confront. Just confront it, deal with it, and move on. And it's so crazy, because half the time the stuff is like, oh, I'm so scared. You be fine. You be fine. Y'all don't be having nothing be going on. It is what it is, but make these folks stand on business. That's why I say, if you're African American, if you are any age, you have hypertension, and you have not seen a cardiologist, my answer to your primary care is why? What are you doing? Why? Why is this person not seeing? Why? Well, I had EKG. EKG tells you what's happening with your heart right now, or whether there has been long-term damage, but it doesn't tell you whether you have a cardiac arrhythmia. It doesn't tell you whether you have blockages around your heart vessels. It doesn't tell you the strength of your heart. It doesn't tell you whether you have leaky valves. It doesn't tell you all that. And honestly, no disrespect, but in a primary's office, whoever's reading it, the primary or the nurse practitioner, they don't have that level of astuteness like a cardiology to be able to read and see little skirmishes. They probably just read the summary and be like, oh yeah, this is normal, right? So my thing is, why have your heart not been assessed? And it's like, we're around the age, the 50, y'all the 40s, 50s, 60s, where you ain't really had no problems. You think everything is okay. And then somebody's like, you need to go to the gym. And Pookie and Mang done went to the gym. And now all of a sudden he done had a cardiac event. And, you know, he's out of there. And the thing is that, but he didn't know he had a 90% occlusion or 90% blockage in the vessels around his heart. Why didn't he know? Because he's never had a stress test. He's never had an echo. He's never had a calcium score. He has never really been assessed, but he's been going to his doctor. So y'all need to truly, truly understand. Stop letting enough just be enough. I heard enough. I don't want to hear no more. They said I'm all right, so I guess I'm all right. No, get motivated and invested in your own care. Please, y'all. Please. And again, if you haven't got your retreat tickets, get your retreat tickets, because we going in like this at the retreat, and the providers are going to be here talking to you and telling you the lowdown and telling you what to do. It's going to be a whole thing. Like, I mean, yes, we're going to have fun. Yes, we're going to love up on each other. Yes, it's going to be that girl. Yes, we're going to have prizes and gifts and all that. But at the end of the day, we're going to educate you and we're going to empower you. Y'all walking out of there 20 feet tall, I promise you. So do not miss it. The link is in the bio. The link is in all my Instagram bios. The QR code is in my Instagram. Like, girl, don't say you ain't know where to buy a ticket. Anyways, I hope this blessed somebody, and we'll see you back on Thursday. Bye.